skills lab, we basically build up our skills from essentially bottom to top.
There are a whole bunch of mannequins that are incredibly realistic. We're taking actual medical supplies and using them to perform a wide variety of tasks that you'll actually end up using in the hospital on a regular basis.
We would split up into groups and practice with our classmates, making sure we covered all the steps, and then one day we would have a validation where we would be tested on that skill.
Getting to know those skills really well and being really good at those skills makes you a better nurse and makes you more confident when you move into the clinicals.
Simulation lab is basically where they create a real-life situation. The professor will go in a room with like a two-way glass, and she'll kind of speak through the microphone, and she'll be the patient.
You have one room that looks just like a hospital room, and then you have a bed with a mannequin in it that does all the breathing, the heartbeat. They can talk through it.
We've done a whole bunch of different simulations in the sim lab that give you opportunities to kind of see how you would react in different situations.
So it kind of preps you for the unimaginable and also for the routine by having the professor really kind of coach you through what to do.
I think it's really valuable to have those situations because you learn a lot about yourself and learn about how you do react and how you would prefer that you react.
It puts you in like a real life situation, like caring for a patient or a medical emergency, without any of the consequences. So you have the opportunity to learn.